All right, I think we are recording. Thank you to everyone for joining us today. I'm Kristen Fluitt. I'm the Senior Quality Manager at the Ohio chapter of the American Academy of Pediatrics, and I have with us Dr. Sarah Denny, who will introduce herself, and she's going to be doing a talk on our Store It Safe program. We really want to thank Jen Johns with AMNCO for bringing us together today, and also to Joy, who also did so much coordination and help with getting this talk together. So I will turn it over to Dr. Denny.
Great. Thanks, Kristen. I'm going to share my slides, but as I'm doing that, I'll just give you some brief background. I am a primary care pediatrician in Columbus, and I work in two different settings, one of which is primary care, and the second is in the school health setting. So I'm seeing a lot of teens and a lot of little kids. And this work that we're going to be talking about today has been near and dear to my heart for many years. And I'll kind of talk a little bit through the history of it. Let me take it off the try and get it over to presenter view. Okay. So I'm doing the same work you guys are doing. I'm in the trenches. I'm seeing what you're seeing. And I know that you guys are really committed to this work already. So I'm hoping that a lot of this won't be new news to you, but hopefully it gives you a little bit more kind of passion to do this work, and maybe a few little tools and skills to help elevate your conversations that you're having with the families that you're taking care of. And Kristen's going to be monitoring the chat. So if you have questions as we're going through, please feel free just to type them in the chat box. Kristen can just jump in and interrupt me at any point. So, this may be new to some of you. I use this diagram for a lot of different reasons, one of which is to talk about how important the work pediatricians and healthcare providers do. So if we think back to the start of the 2000s, motor vehicle collisions were the most common cause of death in children. And we knew that, and it was like that for years and years. And so what did we do? The manufacturers worked on car seats. The pediatricians talked about car seat safety. We worked with our policymakers to pass legislation. And guess what? It worked. I mean, it's a pretty tried and true advocacy strategy, right? So we saw the motor vehicle collisions decrease. But now in 2019, for the first time in history, firearms are now the leading cause of death in children and teens. And so we really need to employ those same advocacy skills that we have been doing with our motor vehicle collisions and employ them on this mechanism that is now killing our children at a really high rate and continuing to increase. This is another interesting chart that came out of the Pew Research Center. So if you feel like you're hearing more and more about this, it's because you are. So from 2019 to 2021, we saw a 50% increase in gun deaths among U.S. children. So it is, becoming more and more of an issue. And because of this, and actually before even all this data in 2019 came out, back in 2015, we were at PAS. It was me and Dr. Mike Gittleman and our CEO, Melissa Arnold, and we were talking about this issue. And we're like, I don't understand, the core fundamental concept of advocacy is bringing everyone together and finding common ground and then building from there. And you're like, why is it that we can't all come together on all sides of this issue and talk about why we don't think a 2-year-old should shoot another 2-year-old with a gun? Like, how can you argue with that? And so we decided that maybe nationally, like the NRA is not ready, or the AAP together aren't ready to have that conversation. But we decided in Ohio we were going to try. And so we decided that the goal of this coalition that we were going to build was going to be coming together to talk about gun safety in a non-divisive way. This is a safety issue, not a political issue. And then what would be some messaging that all of the partners in a coalition around this issue could agree on? So I'm saying it, Buckeye Firearms is saying it, Blackwing Shooting Center is saying it, law enforcement saying it. What is something that we can all agree to, and then promote that throughout the state through all of our different networks? And we were really intentional at the very, very beginning of this coalition to talk about what we were and were not going to be talking about. So we were going to talk about unintentional firearm related injuries and death in children, and then death by suicide of teens by firearms in our adolescent population. We were also really clear about what we weren't going to talk about, because it would be really easy for this coalition to go off the rails talking about any number of other things. So talking about gun registries, talking about Second Amendment rights, talking about our mental health system, talking about our public safety system. So we really wanted to be very focused for the purposes of this coalition. And so in 2015, the Partnership for the Safety of Children Around Firearms was born, with a really wide range of voices at the table. So we had pediatrician gun owners, pediatrician non-gun owners, law enforcement, military, gun retailers, Buckeye Firearms, just a lot of people who came together, and everyone was really committed to trying to keep kids safe. And that was a really fantastic first meeting. And we have continued now. We just celebrated our 10th anniversary, and the work has continued to grow. And I'm going to kind of walk through each of these phases. So the first phase was when we were just focusing on young children. And this was a period of time where we were just doing a lot of listening. And then we were constructing a script based on the feedback we were hearing from our partners that I'm going to share a little bit about. One of the things was that the partners mentioned is that there is a definite distrust of the medical community. And unfortunately, from 2015 to now, that has only worsened. And so that is a reality. So just acknowledging that is a reality was important. Gun owners felt judged at the doctor's office, and there was a real fear of a registry. So, we all have the EMR now, and we're typing things in, and there is a definite fear that if we're typing in information about gun ownership, that data could then be data mined down the road by the government. So that is definitely, we've heard that several times. But on the flip side of things, everyone was really open to conversation, and they really wanted to hear about gun safety from their pediatrician. But they really advised us it's all in how we approach the conversation. And so one of the things that really just helps if you're having this conversation, and I would say before I even get into the details of this, is practice it. And I know that I hate role play, like in the medical simulations and that kind of stuff. But if you even just like practice saying it a few times, it becomes much more natural than when you're trying to say it for the first time during an anticipatory guidance discussion, and it feels like all awkward and difficult. This is a normal safety thing, just like we talk about medication storage, smoke detectors. If you have a pool, four-sided fencing, putting your child in a car seat, if you have a gun, locking it up. The other thing is, instead of just asking about gun ownership, is assume that the families have gun or own a gun. And so instead of saying, do you have a gun, which can seem a little bit accusatory, just saying, if there's a gun in the home, is it locked up? And I really prefer the language locked up as opposed to stored safely, because what I consider stored safely and what you consider stored safely may not be the same. The bedside nightstand is not safe, but if the family thinks it is, their answers can be like, yeah, it's stored safely. So I really like, is it locked up? If they say yes, then hey, that's awesome. That's really great. If they say no, then there's some opportunity for education, and if you have the resources, to give them a gun box. And if they say, well, we don't have guns in the home, it's still really important to have this conversation, because we know that about half of the homes in Ohio do have guns. So that child is probably spending time in a home where there is a gun present. So it's still a really important conversation for you to be having during the visit, but also for families to be having with their children. And so we did that for a few years. Typically at the 3-year well child visit is when we were kind of piloting this and learning that yes, this is a good time to be talking about this. Kids are mobile. Kids are strong enough to pull a trigger. They're very curious. And then we decided we were going to expand to the adolescents. And with that expansion, obviously, we needed to get more of our experts to the table. So we included adolescent experts, suicide prevention experts, and continue to grow our coalition. I really don't think that I need to go into a lot of depth. We all know that suicide is a big problem in our adolescents. It's the leading cause of death in our adolescent population, and those rates are continuing to rise. And also the suicide attempts. Anyone who's spent any time working in an ER knows that the number of behavioral health, mental health visits is really continuing to exponentially increase. And this trend around firearms used in suicide continues to be very consistent. Firearms are used in more than 50% of suicides. They're the most lethal form of suicide. So it's definitely an issue that we need to be talking about specifically. We also know that of youth who completed suicide by firearms, 82% used a gun from their own home. So gun ownership increases the risk of suicide by 3 times in our adolescent population. There was a study done several years ago where the investigators interviewed people who had had a suicide attempt. And what their question to these people, or the patients were, was from the time you decided to take your own life to when you actually took action, how much time had elapsed? And what they found was that 25% of those people had made an attempt within 5 minutes of their decision to take their own life, 50% within 20 minutes, and 71% within 1 hour. So this is a really time-sensitive issue. And that's where the barriers of a gun box come into play, is having that barrier buys you time. And so if we can get through that first hour after they decide to take their life, and we can get them through that crisis, that critical time, and get just beyond that, we have a really good chance of saving that person's life. And so that's like, just like with drowning, you put a 4-sided fence around a pool, getting that gun locked up really provides that barrier. And we also know, this is from the blueprint put out, the suicide prevention blueprint put out by the Academy a couple years ago. We know that our adolescents are seeing us. Even in the year before they've taken their own life, 80% have visited a healthcare provider. 50% had had an ER visit within the year before their death, and 40% had had some sort of contact within the healthcare system in the 4 weeks before their death. So I bring this up, and then the last statistic I'll just say is really quick, sorry. 34% of people ages 15 years and older had contact with a healthcare provider in the week before their death. And so one of the blueprint recommendations is on universal screening, because we see the data shows us that these kids are having contact with the healthcare system. But if we aren't asking, then we're not going to identify them. And I know you guys are already doing universal screening, so I won't spend a lot of time going over that. Just a reminder is that if you're just screening for depression, you're missing about 36% of pediatric patients who screen positive for suicide risk. So you don't have to necessarily be depressed to be suicidal. They're different things. So screening for them separately is really helpful in identifying those kiddos who are at risk. Universal screening is recommended for kids over 12. Or 12 and up, I should say. And then the other recommendations for the younger age groups as documented here on the screen. Okay, so I think that one of the more challenging parts of this, like the screening is pretty easy. We screen for everything. You know, we have maternal depression, we have the MChat, we have our developmental screens. We're screening all the time. That's not a big deal. But where we've found the kind of barrier is around having those lethal means discussions with families. And so just the way we normalize it into our safety conversation with our little kiddos, it's really the same thing with our teenagers. So incorporating this into your safety talk. For my adolescents, I always talk about drowning because we see a second peak in the drowning statistics. And I talk about passenger safety, and I talk about lethal means. And it's not just about firearms, right? We're thinking about all lethal means. So alcohol, prescription medications, over-the-counter medications. We're just talking about how we can keep this child safe. The other thing is kind of going back to when we talked about how we're talking about it, how we're asking about it. Really specifically, when I'm talking about gun safety, I ask some details about, if it's in a gun safe, does the child have access to the key or to the combination? And a lot of the times families say yes. And so then having a discussion about, well, then we're not really restricting access because they do have access still. We need to make sure that that adolescent does not have access. And this does get a little bit more challenging when some of our kids have guns, they hunt, they do shooting for safety. So it's their gun, but how can we, acknowledge their autonomy while also keeping them safe and acknowledging the fact that they don't have a fully mature frontal lobe. They can be impulsive, and we need to restrict access to those potentially fatal mechanisms. Okay. So, as I mentioned, all the visits, and then talking about it in a non-judgmental way, really focusing on safety. And so, just as we do with our little kids, instead of saying, do you have a gun at home? Talking about any kind of lethal means in the home, so firearms, and then being specific about locking up. One of the key things that I hope that you guys take away from this discussion is, of course, talking to the families about, why. A lot of times I have 3 teenage boys. A lot of times they're like, "You don't trust me." When we're talking about social media, "You don't trust me. All the other kids have it," that kind of thing. And I often tell them, like, this is not a function of my trust in you. It's a function of what I know about your brain, and that your brain is not necessarily ready to handle some of this stuff. It doesn't always go over great with them, but it's really not about a trust issue, right? It's just knowing the physiology and knowing that these kiddos can be impulsive and they get really emotional. So sometimes really seemingly small stressors can cause a teen to go into crisis. And so just knowing that that lethal means of a firearm is locked up really keeps someone safe, even if you're not, predicting or thinking that someone might take their life. So one of the keys, as I was saying, that I really want you to take away from this is that even if a child does not have a history of depression, doesn't have a history of a suicide attempt, it doesn't matter. This is a conversation we should be having with all of our teens at their well child or their sports physical exams. And really the barrier, that gun box, can be the difference between life and death. And the other thing I talk a lot to families about is this isn't just a one-time conversation. This isn't just me having this conversation with the family and the child during that well child visit. Should be an ongoing conversation at home, doing regular check-ins like, hey, how are you doing? How are you feeling? How are you feeling about school? Oftentimes I get the fine, it's good, but just making sure that that communication line is always open. And I'm sure you already know this, but asking and talking about suicide does not, in fact, give kids that idea. And so empowering parents to be having those discussions and asking those clear and direct questions at home of their adolescent. The parents start noticing some behavior changes. It's okay to just sit your teen down and have a conversation about this and just do a check-in, make sure they're okay. And you guys, it really matters. As we've been doing this work, part of our last couple waves of our quality improvement, which I'll get into some more details about the quality improvement in a minute, has included a post-visit family survey. And one of the things we asked them was, have you heard about firearm safety from someone other than your physician? And here you can see right here, most people, the majority of people, are not hearing about this anywhere else. So about the highest was 28% had heard about it from somewhere else, but most of the people had not heard this message from anyone else. So if we're not talking about it, people aren't hearing about it. And you can also see over the course of the quality improvement project that we did see improvement in the likelihood of change. So that was another question that we asked families. So I mentioned that we started this program in 2015, and we have, I think of it in 3 different buckets. So we have our education and quality improvement. So education is like what we're doing right now, what we're doing today. And then our quality improvement is where we're really focusing on training pediatricians and healthcare providers to do this screening. we partner with Cincinnati Children's to do a VR simulation training, because as we've moved through this quality improvement work, we hear from providers that the hardest part of this work is having those discussions, especially if a family, is a little bit on the defensive. And so the VR training really helps kind of disarm the family and redirect the conversation to safety of the child, as opposed to the family's rights or any kind of political undertones that you may be getting. Then we have the community engagement piece, which I'll get a little bit more into detail in a bit, but resources for community events. We're only seeing these adolescents once a year in primary care, usually. But they're spending time in schools, they're spending time in their community. So where are other ways that we can get this message to children and their families? And then advocacy. So talking about statewide policies, talking about legislation. So this is the quality improvement program that I mentioned, and we've been doing this for a few years now. We have a lot of different goals related to this. So obviously we want family or providers to increase depression screening rates. We found that pediatricians are actually really good already about screening for depression, and then increasing suicidality screening rates. So this is one where, we have our early adopters where people are already screening for this, but it's not necessarily universal. So we're really trying to layer that in as well. And then we're really trying to increase the discussion around restricting access to lethal means. And then we have a lot of resources, which I'm going to share with you in just a minute. So, just handing those out to people. This Resources for Youth one here is my favorite. And I find that it's really helpful in just sort of opening the door to that conversation. Because a lot of times kids may not be dealing with this issue themselves, but they may be trying to navigate through a peer who's depressed, or a peer who's confided in them that they're thinking of taking their own life. And so now we have a teenager with an immature frontal lobe who is trying to support and navigate another teenager who's in crisis. And so, I find that that is a good way. So, just saying, if you have a friend who is feeling this certain way, here's some things that you can do, or here's a great resource for you, or hey, put this crisis text line in your phone right now so you have it in case you ever need it or a friend needs it. And then part of the other piece of this QI project is just trying to increase provider confidence. At least where I trained for residency, we didn't learn about this in training. And so it's something that I've learned over time and after practicing for years and years and years. And so we know that the more you learn about it, the more confident you are in discussing it. And the more you do it, then the more likely you are to continue doing this throughout your practice with your adolescents. And then, of course, we're using our data around the screening to help decide, are we going to implement a treatment plan? If so, what does that look like? And then monitoring it over time. And then, as I mentioned previously, then we're asking parents and caregivers their perception, which actually was fascinating. About the provider gave the lethal means restriction discussion, but it's interesting hearing, did the family receive it? And also, did the family receive resources, and what was their likelihood of change? We also, and I'll go through, like I said, the resources in a bit, but kind of did a sample workflow. So for practices who aren't already doing this in their normal day-to-day with well child visits, just an example of how that might look in your practice. And what we saw was that participation in this quality improvement did change a significant amount of provider behavior. And we reached our goal in that, providers were having this lethal means discussion at their preventative care visits in our adolescents for a lot of the patients. And in this project, we also include primary care. So we have pediatrics and primary care. So far, we've screened over 14,000 adolescents for depression and suicide. We've distributed over 4,000 lock boxes, and we've kind of
Hey,
gotten
Sarah,
our
I just
message
have a
out to
quick
over
question.
130,000 Ohioans.
I have a patient that I saw today who was seen in the ER, and they were
Kristen, are you
referred
able
to
to
go
mute?
to.
Oh, thank you. Okay.
I think, is that someone trying to ask a question? I wasn't sure.
No,
Oh, sorry.
thank you for muting her.
Okay.
Sorry. Yeah, I definitely don't want to cut off anybody who has a question. Okay. And so the other piece of this is community engagement. So as pediatricians, as I said, we're seeing these patients in the office once. If we're seeing them for depression or anxiety, maybe we're seeing them every 3 months, maybe more frequently as we're ramping it up, but they're spending time in a lot of other places. And so we've really built this coalition to try to reach kids and families where they are. And so partnering with schools and school health organizations, youth and family serving organizations like 4-H, the sports shooting organizations has been really great because everyone has different lived experience. And so hearing and listening and learning from everyone who is a member of our coalition just makes our messaging stronger and just makes our coalition stronger. And we had a pediatrician who's part of the Ohio AAP last year come to us and say, have you ever thought of doing a store safe community designation, sort of like how cities get designated for different things, like a tree? Or mine's like, we have a city designation for our tree growth in my town. I don't know how you get that, but anyway, something similar. And we thought, you know what, that's a really good idea. And so we started looking into it and we started developing a program, and we've grown. We have Beechwood up near the Cleveland area, Cincinnati, Springboro. Actually, Lima was our fourth one to just come on board, and we have a bunch more communities coming down the pike. And it really just helps amplify this message. If you have a gun, store it safe. Like, we're not going to talk to you about should you or should you not have a gun. We're just saying, if you have it, store it safely. And having the community participation has really elevated this conversation. So what does it look like to be a store it safe community? Well, typically the community leadership, so the mayor, law enforcement leadership is on board, and they're doing events out in the community. They're using our resources and really just trying to make this a universal message within their own community. And then we also, Kristen has worked really hard on developing this resource for firearm owner or firearm retailers. So if you guys happen to have a firearm retail place in your community, we offer this as you can either put it on the counter or as a poster, just trying to encourage people, to buy safety equipment while they're purchasing a gun. And firearm retailers, for the most part, do a really great job of this. They also don't want firearms being used inappropriately, but this is just an additional resource that we have created for them. Okay, and I mentioned that really the key to any kind of advocacy is about finding common ground. And so we've done a really intentional job working with Buckeye Firearms and other gun advocates and experts. And we recognize that we're not always going to agree on every single issue with all of our partners, and that's okay. But for the purposes of this coalition, we have made it just really clear and intentional that we all agree that guns should be stored safely. And as a result, we've had support of our entire coalition in talking with state legislators, talking through education, building relationships, with really an ultimate goal of making store it safe the kind of state slogan around lethal means restriction. So just like we have click it or ticket, it would be store it safe. And we've actually had really nice bipartisan support from both sides of the aisle around this work. And as many of you probably know, with the legalization of marijuana in Ohio, we're just seeing exponential increases in accidental ingestions, ICU admissions, ER visits related to edibles. And so this is just another realm where the it in store is safe also includes marijuana products and edibles. And then, as I mentioned, we celebrated our 10-year anniversary last year, but also the chapter celebrated its birthday. So we turned 90 last year. And so we had a 90 for 90 campaign, and our goal was to raise $90,000 for Store It Safe. And we ended up raising over $126,000. So that has been really exciting. and has allowed us to really expand. And as I mentioned, we've been working with other chapters. Indiana has kicked off their version of Store It Safe. And you can see here they've co-branded it, the materials we've used, and Kristen actually helps manage their program. But we really encourage our, people who are wanting to roll this out is to engage with other organizations in the community. There are other people who have shared interests, and you can go further together. And so collaborating, use your existing resources, your existing networks, which I think is really key. And then identify gaps, and then how can you fill those gaps? So like I said, Indiana has taken this on, and they are doing the QI program with our support. It's been great because we can see their data, they can see our data, and it's just continuing to support the work that we're doing. I'm just going to go through these materials for you. These are all available on the Ohio AAP Store It Safe webpage. They're available to any of you. You don't have to participate in the quality improvement project to get these, and you may find that some of this information is helpful in you kind of facilitating that conversation. So I'm going to actually go back. So we initially had a family discussion guide that looked different than this. It was like a 4-page handout, and we did a ton of focus groups, and the feedback we got was, man, this is some really good information, but it's too much. And so we switched it to a digital guide. So if families want kind of a more in-depth thing, they have this digital guide that they can access. But for the absolute essentials, we have, excuse me, I'm so sorry, you guys. Okay, there we go. We have this rack card, and I think that it's really helpful because it provides the family with some information in the event of a crisis. And so the best way to handle a crisis is to be prepared for the crisis, right? Like ideally, no child goes into crisis, but it happens, right? And so it's better to be prepared. And so thinking about that and having discussions, how are we providing a safe environment all the time? How do you recognize if your child is having a mental health crisis? And then what do you do? So kind of an in the moment, safety plan, some things you can see, feel, hear, smell, and taste. Many of you may know the 5, 4, 3, 2, 1 grounding technique, but having families kind of think through this stuff in advance is really helpful. And then, if there's imminent danger, what do they need to do? Who do they need to call? So that's been really helpful. And then this QR code here at the bottom then links to that digital guide that I showed you on the last screen. So again, understanding that kids do have a crisis, planning for the crisis in advance, and then storing firearm safety, because teens are unpredictable. And so, if we just know that all the time the firearms and the other lethal means are being stored safely, then that child can be protected. That's the digital guide that I mentioned. And then because, as I mentioned, we expanded our partnership to include our suicide prevention colleagues, they asked if we would make a resource specifically for firearm owners. So we came up with this with the help of Buckeye Firearms and our Suicide Prevention Foundation. This is available as well. And then the youth resource, which, as I mentioned, I really like. This is my favorite. I use it the most. I like to ask them to please put that crisis line in their phone at that moment. We also know that teens, I'm sure you'll all be shocked, prefer to text than call. So they can do either with this line. And then just, talking through, like, what does it look like if you're feeling sad? A lot of times we'll hear teens say, okay, well, this person said they were going to commit suicide, but not to tell anyone. And so it's okay to tell a trusted adult. It's, that we see a lot of times where that contact, where the person who is receiving the information reaches out to a trusted adult, and that is a life-saving action. So empowering our kids that it is okay, even if they ask you not to tell anyone, it's okay. It's the right thing to do to tell your trusted adult. Acknowledging how someone feels, letting them know you care, and then telling that trusted adult. And then what signs should we be looking for? And then just kind of thinking about stress management, right? So we had a lot of youth input on this resource, and you can see just some ways for kids to decompress. And when we're talking about kind of that crisis planning in advance that I mentioned with the 5, 4, 3, 2, 1, is having the kids come up with 3 things that they can do when they're stressed. Who are 3 adults that you can talk to outside of your family? So I don't know how familiar you are with safety planning, but just having them identify these supports that they have, that they may like know in the back of their head, but like really naming them can be incredibly helpful when they're actually in a crisis. Having it written down in advance is another thing as well. I don't know how many of you have seen this, but Akron Children's did this a couple years ago, which was really cool. Founded in the Store It Safe principles. And what I really love about this billboard is it is not just firearms, right? It's talking about all lethal means. So this is fantastic. So I'll leave you with this. I know that the work that we do every day is really hard, but it's also really important. And I would say now more than ever, it's really important. And what you say and what you do really does make change, even though sometimes I feel like people don't hear us or people don't do what we say. The data that we're seeing shows that it really does make an impact, and they are listening, and you are changing behavior. So I put in just a couple resources. Obviously, I have tons of resources, but here are just a couple things that you can do. And then obviously the link to our Store It Safe webpage.
Yes, Joy, I saw your comment about slides. So I will be sending an email with the slides, with the link to the slides.
Okay, thank you. It just sounded like she was talking from them and we're not seeing them. So that's what I wondered.
Oh, wait, you haven't been seeing any
I
slides?
could see him, Joy.
Oh, I
That's
haven't seen
anything.
any for a few minutes, so that's why I wondered.
Yeah,
Maybe it's
Oh.
just me. Okay.
Okay. Yeah, so I'll send you a follow-up link, a follow-up email with the slides, a link to the recording, and then I'll also include our website link in there. So you'll have that all handy in one email. Were there any other questions or any comments that anyone had for Dr. Denny? We do have some time left.
Is everyone else seeing the rest of the slides?
Somebody put a
Thank
thumbs
you.
up if they could.
Yeah, I see the thumbs up. Thanks.
Oh, great. Yep, we have a comment too so it may have just been on Joy's end.
In a moment of panic, I was like, did no one see slides the whole time? How boring for you. Just to hear me talking.
All right. If anyone has any questions afterwards, feel free to let me know and I can always send it to the group. But Kristen, I don't know if you're going to send everything to me and then I can forward to the group, or you're just going to send.
Yep,
Okay.
I can do that. I'll send it to you and then you can share it out.
Okay. Sounds good. But if you all have any questions after the fact, then feel free to reach out to me and I can get the answers from them. But they will be sending sometime soon the boxes to us. We already have our consent form that we use that we can scan into Epic when we give out one of these boxes. So we'll use the same one that we had from our boxes before.
The ones that you guys will be receiving are really great because not only can you store a gun in them in the home, but they also come with a cable, and that cable attaches the gun box to the frame of the seat in the car. So for example, I'm assuming that your hospital is a no firearms area, but if someone is concealed carrying and then they are taking their child to the hospital, we don't want them just like throwing it in the glove compartment or something. So this lockbox that you guys will be receiving is really versatile in that it can be in the car, it can be at home. And it's really, however you guys decide you want to distribute it. Sometimes when we're offering the lock boxes, I feel that parents don't necessarily accept the lockbox because they're afraid that we're making a judgment or an assumption about, well, I don't want my doctor to know I have a gun. I just told her I don't have a gun, but then I'm taking a gun box or something like that. Often I'll say, hey, if you or a place where your child spends time, if there's a firearm, then take this box. You can give it to your mom. You can give it to your aunt, like wherever the kid is, let's just keep them safe. I don't get too caught up in the weeds as to like, who's this exactly going to? Because then I think the family's more likely to accept it, because then it's not necessarily specifically them, admitting to gun ownership. Then Kristen, do you want to just put in a quick plug for annual meeting, since we have this amazing group of
Yes.
pediatricians with us?
Yes, absolutely. So Ohio AAP is having our annual meeting coming up. Like I think it's the second weekend in October. So it will be on October 10th and 11th. And we would love to have you. So if you are interested, again, on our website, there's a link to register. It is free. We have amazing sponsorship, and so it is free to attend. And there will be a listing of all the educational sessions. So we would love to have you.
It's gonna be really cool. Dr. Lisa Demores is our keynote speaker, but there's gonna be a session on AI, GLP-1 meds. You can check out the lineup, but it's going to be really great. So we'd love to see you all there.
And I can include that link too in the follow-up email, Joy, so that that's handy.
Sounds good. Appreciate it.
All right. Well, thank you all
Hey,
so
everyone.
much
Thank
for
you.
giving us your lunch time today, and we really appreciate it. And if ever there's any questions or resources that you need, thoughts, ideas, please don't hesitate to reach out to us.
Thank you, everyone.
Thank you. Have a good
Bye-bye.
rest of your day. Bye-bye.
You too. Bye.
Thank you.